Heat exhaustion and heat stroke are two very similar heat-related illnesses. To differentiate between the two, the gold standard is to assess core temperature using a rectal thermometer. Heat stroke and heat exhaustion patients may both present with dizziness, hot and sweaty skin, confusion, dehydration, fatigue, and more. If a patient has a core temperature of 105 or higher, then they're now diagnosed with heat stroke. Another sign of heat stroke is combativeness or change in manner. Since the signs and symptoms are so similar, it is imperative to use core temperature as the differentiating factor. To take a core temperature, you first have a patient lie on their side with their top knee and hip flexed. After you cover the patient as much as possible, you clean and lubricate the thermometer. You then insert the thermometer 4 inches past the anal sphincter and tape it down to ensure it stays in place. After it is secure and a temperature of 105 or higher is recorded, you may start rapid cooling using cold water immersion. If cold water immersion is not available, it is also advised to use the taco method, in which the patient is put on top of a tarp and a towel is placed under their arms to ensure their head stays above the water. Water and ice are added to the tarp, and ideally you'd have 3 or more people holding the tarp on each side to slosh the water around for quick cooling. Once the temperature reaches 102, which usually takes about 15 minutes, you then transport the patient to the emergency room. If the patient has a temperature below 105, you should remove the athlete from the sun, hydrate the athlete, and cool the athlete with ice towels.